Hello, everyone, and welcome to the Indian Sun TV. I'm your host, Meghla Bhardwaj, and on today's episode, we're going to be talking to Dr. Raj Khillan, who's a senior pediatrician with Western Health and Mercy Health Services. And Dr. Raj is, of course, at the front lines of the global pandemic. And Dr. Raj, welcome to the show over here. How are you doing today?
Thank you, Meghla, and thank you, Indian Sun TV, for giving me time to connect with the general public and having any good interactions with the public, particularly in a stressful time. Thank you
Yeah.
very much.
Absolutely. And, first of all, I want to say on behalf of myself and on behalf of all of our audiences and everyone in the world, really, thank you. And thank you to all of the medical health workers who are really at the front lines of this pandemic and are literally the soldiers in this war against coronavirus. So first of all, I want to ask you, how are you doing? You have family, of course, and you have to manage your family. And of course, you're at the hospital. So how are you and other doctors and other healthcare workers coping and holding up with all that is going on?
Yeah. Thank you, Meghla. First of all, appreciating the hard work of all the healthcare community is doing, and it is in fact it's a very hard time and a difficult time for all over the world, not only for one nation. So for whole of the world, it is a very difficult time, and this is a time where healthcare community can come together, work hard, and save as many as life as possible. As per the Hippocratic Oath, we are, work ourselves hard, sometimes put our life at risk too, and to save so many life. And regarding coping in this condition, like it is as I said, it's a very, very hard time for all of us, and particularly for healthcare worker, it is more difficult comparatively because we had to make a balance of our professional life and at the same time our family life, like managing your family life with children and at the same time going to work. And it is always a difficult thing, and you always get fear that am I bringing that infection back to my family. In terms of working at the hospital is also stressful in terms of uh, uh, going to the hospital. Always you fear that whether you're going to catch infections over there. But yes, of course, we have to fulfill our responsibility to look after our patients, which we are morally and ethically bound to. Yeah. So I think being a medical professional, always we've been taught from the Hippocratic oath time that we have to carry our profession above so many other things, and that's what we are trying our best to do for our community.
Yeah. So, in your hospital specifically, are there enough, healthcare workers, doctors? Do you have to do, you have to work overtime in some situations, or, are you always on call?
Look, we at the moment we are enough doctors and enough healthcare staff, and but the things may change down the track depending upon when the infection rate increases and the serious infections rate, particularly the presentation of these serious infections when it comes to the emergency and ICU increases. The scenario may change at that time, but currently at this time we have enough healthcare staff, healthcare professionals, and the protective gears are also enough at this time. But it depends upon how many cases we get and how we do we continue to get the a continuous supply of these PPEs, and that's the most important thing. Uh, I would say uh, regarding the preparation point of view, it looks like, I mean, I'm not part of the hospital preparation committee, but there has been enough preparation and directive from the healthcare department to make a lot of changes in the hospital setting to create extra bed and to create more intensive care facilities to accommodate more patients, which are more likely to come in coming weeks.
Right. So around the world, of course, a lot of countries are going into total lockdown. Singapore is in partial lockdown currently. and everyone is being told to stay home. So, do you think that that is the only way to stop the spread of coronavirus? And is there anything else that people can do to stop the spread?
Look, this infection, there's a two-way that the infection can control. One is let the nature take its course. Like if you remember a few weeks ago, UK was talking about the herd immunity concept, and then it, because of the a, a a lot of criticism came from the community and the medical fraternity, and that fades away. And that's the natural course any infections takes when this epidemic or pandemic happens. And second way is controlling infection is to how to slow it down. So slowing it down means we are not eradicating the infections, it is slowing it down. Instead of spreading infections from one person to 50 people, we are spreading 1 to 5 people. So that the whole process of infecting the whole community over that time slow down from weeks down to months. So that means the other way, what we call, people are talking about in the world is, are we flattening the curve? Like instead of having a high peak in the curve, where we having a flattening the curve. So there are advantage and disadvantage of both. I mean, one peak is, as I said, the natural peak is high, and that is the natural peaks, and let the nature takes its course. And that means you will have many cases of infections, in thousands and thousands of infections in a short period of time. And if we take 5% infection, serious infection rate out of that, so then you're going to have 5% sick patients coming to the hospital. But if the number of patients coming to the hospitals more than the hospital capacity to cope with, due to beds, due to ventilator, due to availability of the healthcare staff, then definitely few patients, those who will not get the beds, are going to die because of lack of facilities, lack of beds, lack of ventilator. So the aim is at this stage where I can read the Australian policy is going towards how we can flatten that peak so that our sick rate, those who are needing hospitalization, does not reach above our capacity to cope within the hospital. So that means that this is the way what we are doing at this stage. We are not in a complete down position. We are in a social distancing position where we are slowing the infection rate so the peak flatten out. So instead of going in a peak in a few weeks time, it goes in a few months time. Okay. And so that we can cope with this system. But that is not, again, I would say, that is not the way to eradicate the infection. So eradicate the infection or completing or controlling the infection is the one what you mentioned, and some country has done is a complete lockdown, what China did few months ago. Where absolute draconian way of completing, absolute sort of a curfew been imposed, and you're not allowed to get out of the house unless until certain criteria has been put, and every person is being, tracked by their mobile where your location is. So that is a complete not of a social distancing, that will say no social connections at all with any other person. That's the other way you can prevent or you can stop these infections to happen.
Right. So what is the drawback of total lockdown? I mean, is it possible that if too many people don't get the infection, then we will not naturally develop immunity to the virus? Is that a risk as well of total lockdown?
Look, there is the problem with the lockdown. What happens, which is we are seeing in particularly in China, is a second wave of infections, the re-emergence of infections. So, like if you see the few cases has come up, and the question always comes, we are a human being. So how long lockdown? We have to weigh out always the things. So how long the lockdown you can accept socially? 4 weeks, 6 weeks, 8 weeks, and that has to match with the chances of eradicating the infection. So if you lock down, you do it prematurely, then there is always chances that re-emergence would be, and then putting a re-lockdown again would not be a possible options too. So So there is always a pros and cons of each way we are going. And lockdown is one of the options, but yes, lockdown means it may be like normally what we expect in this type of pandemic. 60% of the population, if you get infected, it reaches to the stage of, theoretically what we can say, a stage of herd immunity. That means the wave will finish by its own in natural course down the track in few months time.
Right. Are you also seeing that it affects maybe the elderly more than younger people?
Like elderly, there's no doubt. I mean, I don't think there is any difference in a rate of infection, because the rate of infection, whether you are a child, whether you're a baby 1 year, or whether you're 1 year old, 100-year-old, if you're exposed, you will be exposed to the infection. So I don't think virus will discriminate in this way. I won't go into the body of 1 year old as compared to the 100-year-old.
Right.
So virus will go to anybody. Important thing is what could be the implication, the clinical manifestation or symptom seriousness of that infections on that particular body. So because with the increasing age, in 70 plus age, our immunity slowly fades out. So chances of seriousness is very high. So chances of infection, our body to fight with the infections, resistant to the infection is less. So it's more likely that it's more likely to be more serious in more than 70-year-old. But why it does not happen in children less than 10 or less than 15 or 20 years of age, we still don't know. It's a big question for all the maternal fraternity, why this infection is not that serious in childhood. Though generally we say kids' immunity is not that strong as compared to the adult.
Mm-hmm.
But that may be the one of the explanations for this too, because the kids' immunity is low. Because what happened, the seriousness of this infection, it depends upon how our body fight against this virus, and that is our body's immune response, which leads to what we call as the ARDS. So if the development of the ARDS, it depends upon also how strong the immune response is. So probably the the system, the immune system of kids has not developed that or adapted that way, that is that strong, particularly for this virus, that it's causing that much a strong immune response that's causing ARDS. So that's why probably the children may not be having a serious infection, but they may still carry the infection. So they may carry the infection rate in that maybe in children may be still the same, and they can transfer to the rest of the family member as the same rate as any adult or any elderly patients will.
Right. How effective do you think are masks to prevent the spread? I mean, we're seeing different countries having different policies. So China has a policy of everyone should wear masks, whereas in Singapore, it is advised only people who have a cough or who are not feeling well should wear a mask. You know, what is your opinion?
Yeah, look, first thing is there is a various type of mask in the market.
Right.
Some are useless, some are effective. Okay, of course, the N95 one is the most effective one with a respirator where you can breathe, and associated inside is a filter there. So that's the most effective one. There is a two-way thing. The protection, why we want to wear the mask. Suppose if I'm infected, am I transferring the infections to you? Other way, I'm normal, I have no infection. Do I have the risk to carry infections from you? So masks are more important. If I have infection, then masks are important to prevent the infection from me to be transferred to you. So where majority of the masks work, even simple surgical mask what we use in a hospital setting, in a theater setting, that is fantastic and it works. So I would say in a child or adult who has the infection, or at least who has in a close contact with the infection, wearing a mask will reduce the chain of transferring the infection from person A to B. But if a family who has a no infections member in the family, wearing a mask at that time is not going to protect each other, whatever mask you use at that time.
Mhm. What about people going out in public, and people who are healthy, they don't have any symptoms, but they're going out in public? Is it advisable for them to wear masks?
Yes, it's advisable in that way because we don't know who is the public is carrying the infection and how close you can reach to that person.
Mm-hmm.
But as far as if you know someone in a close family contact, that's what I told you. If you know someone in a close family contact, there is no infections in the family. There's no point of wearing mask from morning to evening in the house if there's a 5 family member are together.
Right.
But if you are going out and where there is of course, there's a risk of social distancing may not be maintained, then I would say practically it makes sense to wear the mask.
Okay. So, how prepared do you think are the smaller towns in Australia to tackle the surge in patients?
Look, the the uh, the system of Australia health system work slightly differently here in that way because the intensive care the intensive care facilities are more localized to the bigger city or bigger towns, mainly in centralized area. So when we are talking about in whole Australia, the bed capacity is 2,229 intensive care ventilator beds we have. So that we are talking about in all major cities. I'm talking about where we are not talking about a small town 50 or 100 k away from Melbourne or from Sydney. So the small town generally carries a regional hospitals. They have the basic facilities of a, giving the oxygen, a maximum needing up to the what we call as a CPAP.
Mhm.
So more than that, wherever any more than that need is needed, then the patient is here transferred to intensive care. So when it comes to the coronavirus preparedness point of view, that when we talk about any patient who need intensive care, then whether this patient is in the main city of Melbourne or 100 k's or 200 k's away from Melbourne will be airlifted or ambulance via ambulance would be coming to Melbourne area. So that patient cannot be managed over there. But before needing to stage of the intubation and ventilation, that can be prepared. And I think all regional hospitals, to best of my knowledge, they are well prepared in that way. And they have made a lot of internal changes to accommodate a rush of these patients in, and wards has been emptied from not from the elective surgeries. Like elective surgeries, all these hospitals, public hospital and the private hospital, has been cancelled except category 1 and category 2. The category 3 4 surgery has been cancelled. So that is a preparation across Australia wide, where all the beds would be vacant for in emergency cases.
Right.
And 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 the hospital staff has been given, to best of my knowledge, the information that you need to be ready to coming to the hospital as a backup plan whenever is needed. So far we do our all jobs as regular we are doing because we don't have that much influx yet. We are still within the capacity to cope, but things may change in future, we don't know. But we are all ready to go ahead whenever there is a need, whenever my services will be needed more than what I'm doing at this stage.
Right. So, talking specifically about the western suburbs of Melbourne, where you are practicing mainly, so what kind of measures do you think hospitals have over there to manage the crisis?
Look, I mean, the hospital has done many changes. I can't go into the detail
Yes.
because of the certain confidentiality reasons, but hospital has made a tremendous changes uh, in terms of asking more equipments and keeping doctors, nurses, and other staff on standby. And if there is a need, they can be called in as per need basis. And the plan has been made in place how to like do the what we call is a skill mix and shifting one skilled doctor from one category, one branch to another category to help other branches, so that we can't compromise at the same time routine patients what we see, because they also need the same care. And coronavirus won't say that you can't have a asthma, you can't have a diabetes, you can't have other things. So we still have to manage other things as per routine. So but number of doctors managing that can be reduced, and we can be more on the front line and managing more number of patients by the less doctors, sparing more doctors where we need more urgently in emergency or intensive care.
Okay. So do you think as winter sets in, it might get worse? Because, I mean, some people are saying that the spread is slower in warmer temperatures.
Look, let's hope that happens, but I don't think there is any scientific rationale behind this that the warmer temperature can make it less. Because what happens if you see, we whatever temperature inside or outside, in the room or house, our body temperature is maintained.
Right.
Okay, that is at set temperature at 37, 37.4 maximum. You know, so that is a set body temperature, which is our internal homeostasis system maintained our body temperature. So in the same way, the virus, when it goes, it multiplies either in our throat or in our nose. So the nose temperature is whether it's a external temperature 4 degree or 37 degree or 40 degree, that nose temperature would remain the same. That's how we measure. If you see why we measure the core temperature, like with the thermometer, either we measure the temperature, the accurate temperature we measure it either in the ear, or we put a thermometer, old standard, if you remember, doctor used to put in the mouth to check the temperature. So that gives you accurate temperature. So that means your temperature won't make any external temperature won't make difference in your body temperature. So I think there's a lot of myths going on. I think it's a myth rather than the reality that the particularly like people in India, we are thinking about how when the warmer temperature will come, hopefully infection will be controlled. Generally, virus does not multiply that way. Or in Australia, particularly, the winter is coming up, then likelihood that a virus will be more likely to spread. I would say we are more at risk in winter, not because of the particularly coronavirus will multiply, but because we are hitting the normal flu season.
Yeah.
That will put us more at risk rather than the coronavirus multiplication because of the temperature change. And normally we do see lots of flu virus infection happen every year in Australia during winter.
Right.
And if that coincide with coronavirus, that will make the first thing as for a doctor, the picture very confusing. And that will make the overall infections very serious. And we know normally flu can trigger asthma. So children, those who have asthma, that don't have asthma, flu can trigger that asthma. So we will be always treating or thinking about every patient who's coming with cough, respiratory distress, breathing difficulty. Is it a coronavirus? So overall, it would be a more state of confusion, difficult management for us, and the severity of the problem may be more. And it may be a little bit of a more panic for the people. Even if we are sneezing because of the common flu, people will be miles away from you and ask you to rest at home because it's thinking that it is a coronavirus.
Right. Talking about India, how do you think the Indian government is managing things there? I mean, they've announced a 21-day total complete lockdown. What are your thoughts on that?
Look, I would say first thing, it's a very, considering the population of India, it's a very big challenge itself. Lockdown is a lockdown, but that is really a practically lockdown? That makes a difference. Theoretical and practical curfew is a different thing. And managing a population of 1.3 million, 3 billion plus is always a challenge. And the whole world, in fact, I would say, is looking at whether that strategy works for India, and can we do practically apply the same strategies what Modi has has announced a 21 days of lockdown. And I think I would, rather than commenting on whether it's a right or wrong decision, I would say better wait and watch and see how the things will shape up.
There are a lot of theories about the origin of coronavirus. Some people say that it's from wild animals like bats or snakes, and other people say that it's man-made. So as a medical practitioner, what are your thoughts about how it all started?
Look, it's hard to say how it started. I mean, we know that it all started from China, Wuhan. And whether it's a man-made or not, probably, that would be more questions later on to come on when the more research would be done, considering into the genetic and other nature of the virus and whether this virus has been man-made or whether it has been, deliberately spread. That probably, I would say, is beyond my domain to talk about. But yes, we do know that this infection virus can happen in animal, and animal to human transfer is possible. And now we are seeing human to human transfer is is more quicker and faster than the from animal to human one. So whichever way it started from animal to human, but now it has reached from human to human to that stage where it's reaching beyond control. And we all need to work together as a whole community of the world to control it first. And then we can think of later on the blame culture type of things, that
Right.
who started and why the things was not contained at a right time, and whether the right information was given on the right time. That's another big questions comes. But I think that's not the issue at this stage to think about. There's more to talk
Right.
about what we need to do as a humankind for all of us, how to control this infection and save so many lives as far as possible.
Right. So do you think the worst is yet to come? I mean, in the US, there are 100,000 cases today. And the number of cases is continuously increasing in so many different countries in the world as well. Um, do you think the worst is yet to come? And how long do you think it might take for things to normalize and the whole pandemic to end?
Look, the likely worst is definitely depends upon which country has taken what sort of attempts to control it. The worst depends upon that. Like if we talk about Australia, so definitely, worse is likely to come. It's not, we haven't reached to the peak yet. So peak is far away. And when that peak happen, how big the peak happen, that depends upon what measures being taken of social distancing, lockdown, complete lockdown, partial lockdown, and that will delay the peak, and the height of the peak will also reduce down. Country like America, where you mentioned, it's if you look at the population, if you look at the population of America, particularly New York population, then definitely we are still not on peak. We are a couple of weeks from the peak away, and the more likely cases are likely to come. And that's the way every country is different. It's like if we talk about India, the lockdown is completely 21 days. We have reduced the transmission significantly, but as I said, we have reduced down. We haven't eliminated. So that means we delayed the peak. So yes, I would say we every country is putting a lot of efforts to control the things, but peak is still depend upon what country, what efforts putting. Still, majority of the country, the peak is far away. Except the China, you can say the peak is already over because they put the complete lockdown position for a long time, and now the slight reemergence of infection is coming up.
Right, right. That was a lot of good information, Dr. Raj Khillan, and I'm sure people will find it very useful. So before we go, I just want to ask you, what is it that people can do to help doctors and nurses and all of the healthcare professionals who are at the front lines of this battle? What can we do to help you?
Look, what I would say, you know, just stay together, pray to God. This is a big crisis. It will pass. There is no doubt. As a in the world we have faced bigger than this crisis, this will also pass with time. Stay at home, maintain the personal hygiene, social distancing, and follow the rules. Don't break the rules. So if there is a lockdown, social distancing, it does not mean you go to beach with 50 other people, or you can have a party in backyard with 20 people. So please follow the rules. It is a invisible animal we are dealing with, and that animal may be sitting in you, or in your wife's throat, or in your child's nose, or maybe someone else who you're calling for a party, and this may be transferred to you, or you may be transferring to your near and dear one. So just please don't do these things. Follow the normal rules and stay safe, keep maintaining distancing, and keep patience. This crisis will be over with some time. Of course, it will. We have to pay a, a lot for it. Of course, financially, everybody knows we are paying for it. Whole country, whole world is paying for it. But important thing is how many lives we have to pay for it, how many lives we lost, and that's where it depends, and how many life we can save as a healthcare professional, and and that is the most important thing, and that depends upon how we can reduce the infections. So please be safe and follow the rules.
All right, that's really great advice. So thank you so much, Dr. Raj. And once again, thank you very much for all that you're doing on the front lines of this war, and wish you all very best of luck. Thank you
Thank you
very
very
much.
much. Thank you, Meghra, and thank
Thank
you,
you.
Indian Sun TV. Thank you.
Thank you.
Thanks.